Thank you so much, Ronna, and thanks. It's really good to be with kindred spirits. I can attest, as you probably can, to the fact that sometimes we'll find ourselves at random dinner parties and other places where we bring this kind of stuff up and we quickly become the outlier. So it's always good to be with people who get it. Couple of things that I want to just draw your attention to, publications. In 2009, we had a seminar on the psychological impacts of climate change. You can download it. It's a PDF. I can provide that for you here. Also, my wonderful friend Bob Perkowitz, who's been so helpful to everybody, putting people together beyond storms and droughts, publication also about the psychological impacts of climate change. And last of all, something that I wrote a number of years ago, also directed at my colleagues, and that is our moral obligation to act and to warn. So often people ask me as a psychiatrist, why am I talking about climate change? This is the essence of what we do, warning people that their behaviors down the road are going to cause enormous pain to themselves and to others. This is, in my assessment, the very core of why we are doing what we are doing. So that's a plea. I've got this also for you if you'd like to read it. And we can talk more about what things we might be able to do. My good friend Elizabeth Haas is here, and we can talk more about what psychiatrists can do to get that word out, and Ronna, of course, to get that word out to work with our colleagues. So I'd like to start also with the takeaway, which is that I think maybe we should all look at each other and ask ourselves if we can commit together to reaching out to, for example, the World Health Organization. They need to hear from us that we want them to declare climate change as a public health emergency. We need that to establish the social norm, to make everyone aware. And we also need to recognize that this is a political issue. It's fine for us to do all of the things that we're doing, and we're working so hard, but as long as we have people in office, quite frankly, who are blocking enlightened legislation, it's going to be trouble. So we also have to get political. That's a place that we can really exert some pressure, and it will unleash some of the very things that we've been trying to establish, which is that, as we well know, if our authority figures are doing the right thing, if there's policy in place for business and everywhere else, certainly we're going to see a lot of change downstream. So that's another place for us that we really need to act. I'm going to put a fine point on some of the things that we were talking about earlier about violence and weather and national security. I want to point out that for each standard deviation of increased temperature and rainfall, there is a corresponding, well-documented now, 14% increase in conflict between groups and a 4% increase in conflict between individuals. This includes domestic violence, assaults, a rise in the murder rate, a rise in the number of suicides. It is true across all regions and all ethnicities. The impact of society, on society, of climate change is relatively easy when you are measuring temperature and rainfall. How do you measure the impacts on people from water shortages, food scarcity, and frankly, the feelings of future generations that we didn't care enough? How do you measure all the downstream impacts of global warming? And that's the essence of the psychological aspects in my mind. What does all of this have to do about how we feel about each other, about ourselves? Susan brought that up. We are already seeing water wars. You know about the fallout from the California drought, the distrust, the anger, the friction, neighbors telling on each other for their water usage, not that I'm against it, and the ensuing economic losses, job losses, farms going belly up. Texas and New Mexico are in litigation, can you believe it? Fighting over who gets what from the declining water of the Colorado and Rio Grande rivers. They're food wars. Each 1 degree temperature rise in temperature brings a 10% reduction in agricultural output and a corresponding rise in prices. In some places, this goes beyond a dent in the budget and eating less nutritious food. In some places, it actually unleashes where food costs can take up 80% of an income. It unleashes skirmishes, wars. In Egypt, for example, when wheat prices went up after the global market declined, went through the roof with wildfires in Russia, there were huge examples of civil unrest. So it is really frustrating when so-called experts say that money spent on fighting global warming should be spent fighting third world poverty instead. When natural disasters are no longer truly natural, as acts of God or nature, but tied to the actions of humans, putting events behind us is much more difficult. Harm from an intentional act is much harder to get over than something that happens accidentally. What we are doing right now is intentional. It's willful ignorance. Patients can spend a whole lifetime ground down in anger and paralysis, dealing with what their parents did or didn't do right. I hear about it every single day. What will future generations think? Our progeny will know that we knew harm was coming to them and that we failed to take the right action anyway? I won't review all the physical impacts of climate change because you already know most of them, but think about it. Every physical illness brings emotional pain. This suffering doesn't make it into the tally of the psychological impacts of climate change. By the way, studies show that polluted air increased by higher temperatures causes inflammation of brain tissue. Inflamed brain tissue is a factor in depression, and it is a factor in dementia, and it is a likely factor in a lot of other autoimmune neurologic degenerative disorders. From my friend Dr. Eric Shivian's work, some of humanity's most troubling health problems could become treatable by studying our animal relatives. He has written extensively about this. Here are some examples of animals that are essentially biomedical miracles and are at grave risk for extinction. The African clawed frog produces antimicrobials that make them immune to common human infections. They could be the key that unlocks a whole new class of antibiotics. Not bad in an era where bacteria are increasingly becoming resistant. Dog sharks secrete squalamines that cut off the blood supply to ovarian and lung cancers, and maybe others going extinct. Cone snails threatened by coral reef die-offs. They secrete a substance that has 1,000 times the pain-killing capacity of morphine. They are already being used in the spinal fluid of people with intractable pain. This is my favorite. Salamanders. Cut off a limb, they grow a new one. Do you know that we have this capacity hidden somewhere in our DNA? But where? It has become a race against time to get this data before these species go extinct. The impacts of climate change are a breeding ground for psychopathology. The series Years of Living Dangerously featured cables from Syrian diplomats who predicted that the burgeoning drought from climate change would contribute to tribal tensions that did eventually lead to the now out-of-control violence in the Middle East. We're not potted plants out there being drowned, burned up, flooded, and starved, or watching it happen to others. In addition to the conditions mentioned by Susan, I will add a new one, and I know I suffer from it. It's pre-traumatic stress disorder is what I call it. We are modern-day Cassandras in the grip of unrelenting thoughts about future disasters that we know are most likely coming and that we understandably can't put out of our minds. And whether we know it or not, or whether we accept it or not, this is a nation already burdened by anxiety about climate change, and we will be in a growing state of fear, diminished productivity, distrust of each other, simmering conflict between haves and have-nots, callousness in our response to suffering, and an alienated citizenry, which I think scares me the most. These are the costs that will come rolling in that are not being added up. The mental health community is not prepared to handle this large-scale psychological affront to our psyches. As resources become scarcer, the competition for them will become fiercer. Fragile nations will be destabilized. Some will fail. They will look at our per capita emissions here in the U.S., our per capita, not collected, don't bring up China and India. When they do, ask ourselves, where will we be safe? How will we look in the eyes of the world as we ask ourselves to lead by example? Jihadists are already using global warming as a rallying cry against us. As a former CIA profiler, I don't have to imagine how quickly conditions can change. I fear gravely for our democratic way of life. In times of peril and scarcity, people turn to what they perceive as strong leaders to protect them. People are willing to give up their freedoms in exchange for perceived security. Heaven help us from the tyrants who may be unleashed upon us. Corporate interests and politics have been put ahead of our welfare. The mental health community is not doing enough to warn the public. Thank you.